Hello my people, welcome back to my YouTube channel. If this is your first time here, you're welcome. If you're a returning subscriber, thank you very much. I remain Nora Moses Gade, and in this video today we're going to be discussing about signs of pregnancy. Okay, so for the sake of this video, I chose not to discuss the signs of pregnancy based on system changes. That is, when you are pregnant, is how it affects different systems in your body. But I'll be talking about general signs, and I'm going to be categorizing it into 3 parts. The presumptuous signs are those ones indicating pregnancy, but you can't say for sure if you are pregnant or not. And then we have the probable signs. For the probable signs, it's more likelihood that you are actually pregnant. But for the positive sign, man, just go and start shopping for baby things, so it is just there, you are pregnant. Okay, so we're not starting from the down to the top, you understand? It's level by level grading. So for the first one is the presumptuous signs. That one is assumption, as the word assumption signs. I want to be using medical terms so that some people will not come and be saying, Nora, you're taking us high and the rest. But just for you to know, it's called amenorrhea. Amenorrhea is no period. You see your period. When is that time of the month? You're expecting your period, you've gotten your pad and all, but man, nothing is coming down. Then you can start suspecting pregnancy. And if you notice, this falls under the presumptuous signs because other things can make you not see your period. You see why it is part of the presumptuous signs, right? Okay, the next one is nausea. You know, that feeling of I want to throw up, I want to throw up, I want to throw up. Many other things can cause that, but it's a likelihood that pregnancy could be the one causing this particular one you are experiencing. Breast enlargement and tenderness. Well, some people, their premenstrual syndrome, that's PMS, it comes along with this package. When it's that time of the month and they start feeling this, when they start feeling that. But it's not a conclusive sign because other things, as I mentioned, like your period also, can cause that feeling. So you see why it is under the presumptuous signs. Then fatigue, tiredness. Here is paining you, here is paining you. It could be that here is paining you, here is paining you. It's a presumptuous sign that you're pregnant. Why it's not conclusive is because if you go to farm, you're going to get tired and you feel body weakness, back pain, or let's just join it together with the body weakness. Constipation. Any small thing, I feel bloated. It's possible baby is about coming on, but it's not a sure sign because other things will cause that. Then disturbance in sleep pattern. You try sleeping, it's not coming, it could be a sign. The shortness of breath. So shortness of breath is possible. You're trying to change position, you sit here, you're feeling as if your breath is not reaching down. You sit here, it's not reaching down. It's possible you're pregnant. For some, heartburn, nasal congestion, feeling of lightheadedness, tiredness, all these are presumptuous signs of pregnancy. Now we are moving to the higher signs. That is the probable signs of pregnancy. Increased frequency in urination. Increased frequency in urination. Just finish taking this before you know you want to pee. Just go and check. And it's possible if you have some issue with your glucose level, it could be a sign. But now we're talking about pregnancy, so let's stick to that. So frequency in urination could be a probable sign of pregnancy. You can see my shadow, right? It's raining heavily now, and they just took the light. I don't know if our session will continue for now. So we are continuing, So as I mentioned, one of the probable signs of pregnancy are abdominal bloating, like constant one is another probable sign being pregnant. Mild cramping. If I say uterine cramping now, it's grammar. So mild cramping, you're feeling some contractions and all. It's possible you're pregnant. Increased skin pigmentation on the face, on the stomach, and area of the areola, around the nipple area. All these are signs. Breast enlargement, as I already mentioned, they also fall under these signs. So don't forget, pregnancy is not It's the same all across. To be different for you, to be different for the other person. Even you will not have the same kind of pregnancy. Oh. What you experience in your first will not be what you experience in your second and your third and subsequent pregnancies. So now we're moving to the ogbonge signs, positive signs. This one, if they are there, as I said earlier, men, just start shopping for baby things. Just be looking for baby things and start shopping, saving for them. If you're able to go to the hospital, eh, and they show you using scan, ultrasound scan, and show you baby's movement and position, you are pregnant. So you are pregnant. Baby is there. Baby you are seeing life. It's not food. It's not food that is there. It's baby that is there. And then if they're able to check the fetal heart rate for you, there's a sound you hear when they make use of all those things that they use. They don't want to speak grammar, and you're not hearing that do do, and your doctor or your nurse is telling you that that's the sound from your baby's heart. It can't be food that is making that sound now. It's your baby. So my sister, you're pregnant. And you know that HCG now. That HCG test that they used to check. When the lab tell you that, okay, sister, bring your blood or bring your urine, let's check for you. And they're able to check. Then they now write that you're pregnant. They can't form that result. It's your pregnancy. It's your baby. Just get ready. So either blood sample or urine sample, and they're able to check and find out that you're pregnant. Then you are pregnant. So as I mentioned earlier, these are just few. It's just like a summary. This is a summary of signs you get, or will I say symptoms? Symptoms, because signs are what you see, while symptoms are what you feel. So I can just say signs and symptoms. So for the breast enlargement now, you see it live. For the change in nipple color, you see it. You understand? But for the symptoms, all those constipation, bloated abdomen, and all you feel, all those ones are symptoms. So for today, that is where we are going to stop on our discussion on signs and symptoms of pregnancy. Have you been pregnant before? Are you pregnant, or you feel you are pregnant? What are those signs you expect, or what are those signs you notice? Share your comments on the comment box so that we can all learn from each other. That will be all for now. The rain didn't stop us until some other time. I remember Moses Gade. Please, if you haven't, ensure to subscribe to my YouTube channel, like this video, and comment if you liked it. Then you can give a dislike if you don't, so that we'll see where we can improve more. Bye.
Promise all these years we'd pack our things and disappear. I never thought I would see you here after all this.